Ambulona Ado, Mina Dr. Francis Hui, Mina Dr. Fodembele Umandem, and the Uman Sick them. January na Cervical Cancer Awareness Month. So the topic for today is cervical cancer. The cervix na the part where they connect the womb and the vagina when the woman in private part. So because it is so inside, na something we often neglected because we need to see them, and now also part of the taboo subjects that we need to openly talk about. But cervical cancer is a very common cancer among women. Actually, the second most behind breast cancer for women really between the ages of 15 and 44. So quite clearly, now something we will be able to talk about, so we know ways how we go able for prevent them. The causative organism usually in a human papilloma virus. There are different types of human papilloma virus, but some of them don't be implicated in cervical cancer. And this virus is usually sexually transmitted, so through mommy and daddy business. Now, most of we don't get this virus before in different parts of stages of our life, but if your immune system really good, now something your body can able for clear. But some people are obviously not able to do that, and that's the time where the virus can stay and eventually cause a cancer. Especially in women, we're not going to do screening, so you're not going to even know say changes that happen within your body for you able to rectify at an early stage. Now we get something in what we call risk factors, like waiting at the things that we will make a likely for you get cervical cancer. So say for example, if you just smoke boko, if you just smoke boko, it cause changes within your cells. We make a highly likely for you get this condition. If you're not person with unborn boko picking again, because for you born through the cervix, if you're born naturally, not through the cervix, they pass your cells, then they change. If you're not person with what we call immunocompromised, the thing really fits. Infections or certain sickness within your body, it already need to work the way I suppose for work. It will make this virus where it can be able for stay. If you're not person also, we don't get multiple sexual partners. This is another reason why you're more likely for get the virus from this person or that person. And with something and if you don't get certain diseases the way they pass through mommy and daddy business, it will make the virus more likely for stay. So age now other thing we can consider. And also first way they say, oh, cancer may happen past you about 50, but that's not so true, because nowadays the way how we bodies and day and due to with lifestyle and all of the eating and day, we see certain conditions in people that weigh extremely less in age. So for example, me go don't see somebody who gets cervical cancer with old 25 and not mean to say past your 50. So the age zone, it can be at any age for less something like that they happen. Now, person where we will say don't get this condition, go present with maybe they will get discomfort in the vagina. Maybe if you be don't left for same period, all of a sudden it will begin bleed. You will get irregular bleeding even if it is same period. Something day you will get after you and your man meet, you will get bleeding after that episode day. Something day also offensive discharge, and this is very important because mostly women in this part of the world we get discharged, which they say I don't get infection. You don't even think say it could be something else. You go to hospital, you buy what you want buy or pharmacy, and then you get a move with. The way you come back, you say, oh, I don't get other infection. So this now all of the reasons then why I make this video they be made. Following you know, say some of the symptoms I also not mean to say like weight loss, also the part of this for any kind of cancer. For example, some of the symptoms are also not specific. So if you get something where you know say they monitor you, if finally you can at hospital, let we able for no waiting for do. Clearly, if you come, we're going to examine you, we're going to send you for certain tests, maybe take a sample of the cervix and see if something did it, for see if any problem did it. If na cancer you get, we're going to know like the stage or the type of cancer, because then kind of thing and they determine the kind of treatment where you did get. All this, the most important thing na prevention. We don't want to let you even get it sick, or if you get it sick, let it be like for say we able for catch and so early mind you, within a place society we not get all the modalities for able to treat somebody we don't get advanced disease. So the first thing is let you not get the disease, but if you get the disease, let it be to say we able for catch her early enough. So the OSI, maybe surgery or certain medication could actually help you and prolong your life. Now, they talk about pap smear. Pap smear now like where we they take a sample of the cells then within the cervix and test them. Then they go able a part of what we call screening, or we actually test for that virus, the HPV. So then two things then they obvious now ways there how we they able for know if you get the condition or if your cells don't begin changing in a way that we carefully put more attention to you and pay attention to you for make sure say no progress to an actual cancer. A couple of years ago, government also rolled out a vaccine. The vaccine very important, although widespread, we don't get bokuna salon. But between the ages of 9 and 14, young girls then they will be able to get, especially obviously no sexual intercourse yet, we will forget this vaccine so that eventually in their adult life, where they begin engaging sexual intercourse, if their partners then get them virus there, so they already don't be vaccinated against. Now, this not to like for say 100% proof you know go get them, but it certainly will reduce the chances of you getting cervical cancer. So the theme for this 2024, for this January Cervical Cancer Awareness Month is Learn, Prevent and Screen. We want to say we spread the message enough. We want to be like for say the information day. The information is always key. We want to be to say the information day. Yourself going for pass on to your next person, and we want to be to say una participate in screening modalities. So come for your pap smear for let you know your status. Usually by the time you all 21, you for begin do pap smear. If you're sexually active earlier, certainly you will maybe begin screening earlier. But by the time you're 21, you for begin do a pap smear. The subsequent thing they will go ask you depend on if you're HIV positive, because then people then they can usually need for do more frequently, and the results we will go get. Then they will also determine how often we do them. But please can do your pap smear. Take charge of your health. Then they're very important for this 2025. So till next time, me and Dr. Frances Roy, they wish you all a happy and a healthy week ahead.